And I'm going to, so I've removed the old ostomy bag, and I've given this a little wash with just some warm water and a soft cloth. Some facilities contradict using soap because they say it dries out the stoma, but then others do. So I would say that's not a critical element, just follow the policy of that facility. And so now we're going to do an assessment of the peristomal skin. And on this manica, there's lots of old adhesive on here. So if you had a client and this was their skin, you'd want to somehow get this adhesive off so it doesn't build up. So that would be part of cleaning the area. Also, prior to putting on your new bag, you're going to want to make sure this is nice and dry, and check with them to see if they use some sort of a skin barrier when they're putting their new ostomy bag on. When you've taken off the old ostomy, also in the assessment, you'll be looking at the amount, color, and consistency of the effluent that's coming from the stoma site. And I'd also just check to see how they're feeling and if they're, is this a new stoma? Because we know if it's new, the sizing will change within 4 to 6 weeks. It'll start to, some of the swelling will come down and you'll have to resize it. So in order to size it correctly then, we've gone through our fundamental pieces where I'm making sure I've got the right patient. I've, of course, performed hand hygiene. I've checked the policy and procedure on how to change an ostomy bag. Privacy, and then, of course, there's sometimes odor is an issue, so you may need to use a hospital-approved deodorizer of some sort. So, in the boxes with the supplier, there's a gauge that comes. This is the one from Hollister. So you actually try and match up as close as you can to the diameter of the stoma with this site, or sorry, with this circle. So with this one, I'm going to say that 32 millimeters is probably my best selection for cutting. 35, oh, actually that might be better. In your textbook, I didn't see that they'd asked to leave 1/4 of an inch between the edge of the bag and the stoma, but that is fairly common practice, so we are going to include that in our critical element. So does everyone agree that 35 millimeters would probably be the best size to select? Okay, so now it's just a bit of crafts. We'll look on here, and I'll look for the 35 millimeter circle, and there isn't one. So I'll match this up to where it should be. So it's just a little bit in the outer edge of 32. So you could draw, just get a pen or a pencil and just draw a circle. But at some point, even eyeballing it, you're probably pretty close. And then get a pair of clean scissors. Make sure you're not going to snip your bag by mistake. And then it's just a basic, just cutting a circle. You have to stick out your tongue when you're cutting. Okay. Okay, and then of course don't lose your scissors. You'd be surprised how many times these end up in beds, in the sheets. So know where they are. That's going to go in the garbage. With this particular wafer, they sometimes do recommend just warming it a little in the hand. It'll stick better. So we're dry. Okay, Mr. Smith, I'm just going to put your bag on. Uh-oh. Okay. And try to get right centered over. And then I just like to warm it for a minute. Yeah. Just clean gloves, yes. And just to think GI system, GI is not a sterile system. That's how I always remember. It helps a lot. Okay. And then, so that's on, and now we've got to do one of the most important things is to clamp the edge of the bag. Some patients like to have it sitting the opening in different angles, and if they do, then that's okay. Let them do what they're comfortable with. So you can see this clip. You just pull it forward and pull it towards yourself to open it. These are reusable. They only have so many in a box. So don't throw it away accidentally. I've done that before. Accidentally. And then it's just like you just overlap it, like those chip clips. And then, oops, I've got it on the wrong side. Don't do that. There we go. And I don't know if you can get a couple of turns, just so it doesn't leak on you. I find sometimes if I get it wrapped too much though, then it's too wide to get into that little slot. There we go.
Yeah.
Yeah.
Good.
Yeah. So like
Pink.
soft,
Soft in
Yeah.
consistency.
and moist. Yes, if it's blue, that's bad, or black, that's bad. That's dying and that's urgent. You'd have to notify the physician.
What would you document after you're done? Like, would you document like the time and the date and what it
Let's
looks
just
like?
see. Yes, you would. Skin barrier applied, time of procedure, amount and appearance of effluent in the pouch, location, size and appearance of the stoma and condition of the peristomal skin and the electronic or paper record of the chart. Record the patient and family caregiver's level of participation, what teaching you did, and what their response to the teaching was. Report any of the following to the nurse or healthcare provider physician. If the stoma was abnormal, if there was an issue, if there's a suture line, or peristomal skin, or character of output is unexpected outcome or a variance. Just to add as well, of course you'll complete your hand hygiene when you're finished, but if you have someone that's got a lot of gas, in some of the colostomy bag styles you're going to need to relieve the gas and let it deflate the bag so that you don't have your seal being popped off with gas. So if you see the bag increasing in size, then you know that's the issue. The other thing I don't think that I did is that there's a secondary piece of paper under the adhesive, so just to make sure everything is secured.